issue of clots, right? What are they and how can they be avoided?
Yes. So there are multiple reasons why women will have clots. It could be because you're eating foods that you are sensitive to, or you're eating foods that you're allergic to, or you have things in your environment that you're allergic to.
Mm-hmm.
Or they could just be because there's a issue within you, a systemic issue. And so the way to avoid that would really just be to avoid allergens. So it's in when you bleed, you're supposed to just bleed continuously. You're supposed to bleed and then you clot after bleeding. But if your system is bleeding then clotting, then trying to clot and then bleed and clot, that's a problem. So think about whenever you scrape your skin. Let's say I fell or I cut myself while I was cooking and I bleed. After I bleed, then a clot forms there. And the purpose of the clot is so that I don't bleed anymore.
Mm-hmm.
So it's like tissue that forms right there. There are what we call clotting factors and different proteins that will gather at that site so that we can stop bleeding. Now, if you have blood clots, that means that your system is bleeding and then they're trying to stop the bleeding, but then there's bleeding that keeps continuing and then it's trying to stop the bleeding again. And so it's really dysfunction of the menstrual cycle. So you should just have blood coming out and then it should clot and then you shouldn't bleed anymore. But if you have blood clots, that means that your system is trying to say, okay, I'm done bleeding, but then it still continues bleeding.
Okay. Yeah.
So avoid allergens, be careful what you put on your skin. Your body could be reacting to something, or it could be the sign of another underlying disease.
Okay. So at what point should we then seek medical intervention?
If it happens every once in a while, so if you look at your blood and you see just a few clots here and there, you can. I would suggest that you take advantage of some of my resources. You can do a detox.
Mm-hmm.
And so if you do a detox at that point, then you can get rid of that blood clotting. But if you have like serious, every single day of your cycle, you're seeing clots coming out every time you change your pad, then I would say you should definitely take a picture of it and definitely go and seek medical attention for it. So if it's a little bit here and there, it's something that could probably just be fixed by you changing your diet and other environmental factors.
Okay.
But if it's serious, then it will require some further testing.
All right. No, great. Thank you. Thank you for that. So there's a question that's come in from one of our viewers. They're asking, this is a gentleman. He says, this is good. Educational discussion, ladies. Could you define men's supportive role during the menstrual cycle?
Yes, the supportive role that a man plays is very, very important. But number one, men need to know what their woman goes through during the menstrual cycle.
Mm-hmm.
So for me, I can talk about myself and my husband. While during my menstrual cycle, I'm not in pain. I'm not like extra moody or I don't have those types of symptoms. When I'm on my menstrual cycle, I want to spend more time at home. I want to spend more time hugging on my son. You know, I'm different during my menstrual cycle. I want to spend more time by myself sometimes. I want to lay down more. And so he understands that. And so he needs to be a little bit more bending in certain situations. Sometimes he may have to eat the sadza from yesterday. As much as he doesn't like that. He may have to eat the sadza from yesterday. Or he has to bend a little bit. So I think every man needs to know what their woman goes through. If your woman is telling you during my menstrual cycle, I have headaches, then be supportive. Do not do things that will trigger the headaches. Take the kids out so there's no noise in the house. I encourage men that when a woman is on her menstrual cycle, take them out to eat. Make the workload a little bit easier on them.
Mhm.
Do not frustrate them a little bit, especially if you have a woman that has mood swings around that time. There have been times during our relationship when I have had months where I've had mood swings with my husband, and so be upfront with your partner, like, hey, I'm on my cycle. So when I'm on my cycle, I'm a little bit extra moody, or
Yeah.
when I'm on my cycle, I'm in pain, so I lay down. So I think it's on the part of the woman. We're taught not to have these conversations with men, but I
Mhm.
tell women, no, have these conversations with men. Let them know, sit down with them.